Good morning, everyone. Will Dupree here in the KXAN live studio. We're about to take a listen to this press conference that Dr. Mark Escott, the interim health authority for Austin-Travis County, is holding. This is about public enrollment forms that we launching over the next week for COVID-19 testing here in our community. So let's take a listen.
Our system, our hospitals still have plenty of capacity for ICU patients. Still, we have plenty of ventilators, and we also have more than 200 people now recovered. And again, those numbers are reassuring to us that we acted quickly enough to help limit the risk of getting beyond our hospital surge capacity, and we're refreshed about the direction that we're headed. However, we're not out of the woods yet, and it's important that we remember that the steps we've taken to get to where we are now, to prevent that spread, to flatten that curve is working, and we need it to continue working. That means we have to continue to stay home and only go out for essential needs. We have to continue to social distance. We have to continue to wash our hands frequently, to avoid touching our face, to make sure that we're cleaning commonly used surfaces frequently, so that we can continue this effort. And now, of course, this week that also includes the wearing of masks in public or other facial coverings. These efforts will continue to help us stretch out that doubling time, which for the city of Austin and Travis County has moved from 2 days to 5 days to 7 days to now at 10 days. But even at 10 days, we are still seeing increases in cases. So over the last 7 days, we've had 394 new cases. The 7 days prior to that, 291, and the 7 days prior to that, 214. What we do want to see is those numbers decreasing week by week, those new cases decreasing, so that we can be in a better position to start reopening businesses, to get people back to work. But we have to do that in a safe and effective way to ensure that we can continue to manage this epidemic and this pandemic here in the city of Austin. Regarding the system that we've set up, this is a public-facing enrollment process. So this removes the barriers that may have been there before that required individuals to go to a physician, their private physician, or a telehealth provider to be enrolled for testing. This effort removes that process. The individuals, the community can go directly to this website that's being created that we expect to roll out over the next week to sign up for testing, to get information about COVID-19, and for us to not only enroll them for testing, but to also help us in the contact tracing piece that you've been hearing so much about lately. This automates a significant portion of that contact tracing, which is really critical. As we open the window to the economy again, it's important for us to be able to continue to track folks effectively, to make sure that we are reaching out to them often, to check on their status, and that we know who they've had in contact with. And this system that Dr. Hewitt's going to talk about really helps cover all those bases to ensure that when we do reopen the economy, gently, progressively, we can do that safely. I'm going to turn it over now to Dr. Hewitt, who can provide some additional details regarding this system.
Austin Public Health has worked so hard to put together so that we can provide a really good service to the community. First, what we've developed is a community-facing tool that will allow the public to go and enroll without having to go and see their physician. This tool will create will use an algorithmic-based assessment to evaluate whether or not you qualify for a test currently under our resources and the testing availability that we have. If you do qualify for a test, you'll get scheduled, or you'll have the opportunity to schedule at one of our testing sites. We've worked really hard with the City of Austin, with numerous partners here, to make sure that we have an efficiently running testing site. We average about 8 minutes per person going through our sites, because we really wanted to eliminate that time that you spend sitting in line in your car and sitting on the site. And so we've tested over 1,000 people at our sites so far, and we plan to increase that capacity up to over 2,000 per week as we go forward. After you complete that test, we've worked with partners around the state to find ways to get your results to you more quickly, so that you can have an answer on if you are positive, what you need to do to isolate yourself from your family and keep your family and friends protected. All of that, having those results, feeds into that contact tracing piece, which will be very important to getting people back out there and identifying this and controlling the outbreak as we move forward.
We're happy to take questions if they're out there.
Hi, this is Olivia Aldridge from Community Impact Newspaper. Thanks to both of you for answering our questions. So this first one comes from Community Impact. With the new form and the lifting of the requirement to go through a medical provider, do you expect to significantly ramp up the number of tests performed in Travis County, and by how much?
Yeah, that's a great question. We do expect a significant increase in those who sign up for testing because we're decreasing that barrier. And while many in our community have had access to their primary care physician or telehealth, we know that there are some folks who really struggle to do that. So this removes that barrier. It increases the equitable access to testing for folks. And, we expect a significant increase. We've seen this roll out in other states and other jurisdictions. So we expect thousands of people may want to be tested. I will say, in addition to symptomatic individuals, this system allows us to identify areas that have high rates of infection and allow us to say that in those particular areas, we also want to test asymptomatic people. So it allows us a lot of flexibility to change our strategy as the pandemic unfolds here in Austin.
This next question is from KXAN. How does this effort fit into the overall plan of reopening the local economy?
So as we've said for several weeks now, having adequate testing capacity, adequate access to testing for the community is one of the critical steps for us to consider reopening. There are other steps also that we have to consider. We have to see a decrease in the number of new cases for a period of 14 days, which is another critical step. We have to make sure we have adequate supplies of personal protective equipment. So this is one of many steps. We're happy that we're able to take this step here in the near future to allow the community to sign up for testing. And I will say that one thing that this new system allows us to do is, as the testing capabilities change across the community, we can continue to add components to it. For instance, one of the things that we're working on with our community partners as well as private partners is what we call crowdsourcing of testing. So that means in the future, when individuals go in and say, I have symptoms, I want to be tested, not only could it pull up the Austin Public Health options for testing, it could also pull up community care. It could pull up Ascension Seton sites, Baylor Scott and White sites, St. David sites, or even Walgreens or CVS or private offices. It's similar to in field to what people may have seen this year for flu season if they wanted to get a flu vaccination. We're hopeful that as individuals, as businesses can continue to increase their offerings of testing, that we can feed all of this into this one system so that we can accurately track who's being tested, but also provide that much needed contact tracing and information for those folks as well.
From CBS Austin, where else have these particular tests been used, and how accurate have they been proven to be in those places?
So the testing that we're using is the testing we've been using all along. What's changed is the platform that we're using to sign up for the testing. So this is still the PCR test, the nasal swab test that we've been using, but we have identified additional labs. As the weeks go on, more and more labs are coming online to be able to offer the testing, which is good because it not only increases capacity, it improves the turnaround time. As you may have seen and heard over the past several weeks, the large companies like LabCorp and Quest sometimes have turnaround times of 7, 10, 14 days. So as the numbers of labs increase that are offering the same kind of test, the PCR test, that turnaround time will decrease. It will provide us better information, quicker information, which allows us to respond and isolate people quicker.
And this question is from Fox Austin. Is there consideration for widespread testing for anybody, including asymptomatic people, which is what the city of Houston is doing right now?
So we're paying attention to what Houston's doing. We're going to pay attention to the results they have with that. The challenge with widespread asymptomatic testing is, number one, we have to have much more capacity to do widespread asymptomatic testing, which we still don't have and don't expect to have for the next week or two. But it's also a factor of how much disease is in the community. You know, the lower the rate of infection in the community, the higher the risk of a false positive in that circumstance. That's why we prefer right now to identify those areas that have higher rates of infection and do targeted asymptomatic testing to make sure that we're maximizing our effort as well as the dollars being spent towards this effort.
This is from Estonia. Will physicians continue to refer patients to testing sites, or will all test access be controlled via the new Austin public testing enrollment form?
I'll answer that, and then I'll have Dr. Hewitt comment as well. Doctors can continue to order tests on their own. They don't have to send folks through this testing site. You know, right now, when we first rolled this out, people will be able to sign up for the drive-through testing that Austin Public Health is offering. Again, our hope in the future is that crowdsourcing model where, you know, wherever that individual is pointed to testing, that information will all feed into the system and allow for us to have better ongoing surveillance of what's going on and allow for more players to come in to offer testing. But I'll have Dr. Hewitt see if he's got any comments to add on that.
Thanks, Dr. Escott. Yeah, so the idea of crowdsourcing comes from what our community has done so far. People really want to make sure that we're getting testing out there. And so different clinics and pharmacies and other places have worked on developing processes to get people tested. What we want to do is help to resource them so that they can continue to do so. And as they do that, and as we help to supply them with resources, we hope that our platform will help to give the community access to all of those points to make sure that everybody's getting tested in an efficient way, getting the results efficiently, and getting tracked so that we can really see what's going on with this disease throughout the city.
From the Austin Chronicle, what circumstances would make it necessary to require people to be tested? For instance, if a business wanted to reopen, or maybe there's a cluster.
So, you know, in circumstances, we may have to require people to be tested if there's a cluster in an institutional setting, for instance. You know, I don't expect that we're going to require widespread testing at this stage. I will say that as we talk to businesses and we look at models in other states, other countries, that testing, that question of required testing continues to come up. You know, do we test people when they report to work to make sure that they're negative before they start working? You know, these are policies we're thinking about. In order to have a system like that, we need much greater scale testing, and we need it quicker, and we need it cheaper. So we need a test that would reliably be able to tell us an answer, yes or no, this person is infected, within a few minutes, 10 or 15 minutes. So my expectation is that over the next month to 2 months, the rapid testing is going to quickly take over the send-off testing, at least as that initial screen to determine yes or no, this person is currently infected. I think the better capacity we have for that, the better ability we'll be able to control this outbreak and do so safely as we reopen businesses.
This is from Spectrum News. We've got a press conference coming up from Governor Abbott later today. Does the mayor of the city of Austin plan to follow any guidelines given by the governor when it comes to reopening the state?
You know, I don't want to answer for the mayor or Judge Eckhart. You know, I think that in discussions that we've had with the state, you know, I think they want to be cautious too. I think the state wants to balance the needs of the economy and the needs for public health protection. But we're in a better situation now. We're going to be in a better situation at the end of this month than we were last month. We have increased testing capacity. We have better command and control over the situation. We have improving situations regarding personal protective equipment. And I think these things are going to help better prepare us for that reopening process. But we also know that when we have businesses that are closed, when we have people out of work, there's also the potential for long-term health consequences that we have to consider. And this goes back to a discussion we had regarding South by Southwest. It's not just a matter of what's good for the public health right now. It's balancing that with the long-term implications for public health. And, I think that's what the city's doing, the county's doing, the state and the nation is doing, is looking for that appropriate balance point to make sure that we're moving forward safely.
This is another question from Community Impact. You mentioned, Dr. Escott, that these will be the same PCR tests that we've been using. How do health officials verify the accuracy of PCR testing and protect against false positives or false negatives?
So, quite clearly, we're always going to have false positives and false negatives with any test. There are very few tests that are 100% accurate. The tests we use are the FDA-approved tests for PCR testing for COVID-19. They're as accurate as we have now available. And, it's important that folks understand those limitations. Having said that, the accuracy is very, very high for these tests. We have to accept the fact that there could be false positives and false negatives. And part of what I said before about the asymptomatic testing is important to consider. The more or the lower the risk of the community that we test, the higher the rate of false positives are going to be. Similarly, in testing people where the disease burden is high, there's a higher risk of a false negative in that circumstance. So those are the factors we have to balance when we consider testing strategies, and we'll continue to monitor that situation. I do want to point out something else that has come on the market recently in Austin and across the country, and that's the serology test or the antibody blood test. Some folks are using this and marketing this as a screening test for if a person has the disease currently or not. This is not what it's designed for. If somebody develops COVID-19 today, it may be 10 or 14 days before that blood test is going to show they're positive or not. Having said that, there's also great variability in the accuracy of those tests individually. So it's important to know what that accuracy is for those blood tests, because they are wildly different from one to the other. And one of the biggest problems with that antibody testing is there's cross-reactivity with a lot of other coronaviruses. In fact, the most common coronaviruses. And that poses a challenge because it may show that you have immunity on the test, but the immunity you may have is not to COVID-19, it's to a different coronavirus. So people need to be very careful when they make decisions to do that testing at this stage, particularly if it's not an FDA-approved test, and ask their physician or the person doing the testing about that accuracy, because the accuracy for those tests are going to be much different than the ones for the PCR tests.
Another question from KXAN. What's the average turnaround time for tests now, and how will this increase or decrease that turnaround time?
So our partnership with our labs has been very good. We have been using local labs to try to avoid some of the backlog with the bigger national companies. And our tests has generally been in the range of about 2 days. We expect with this new company that we're working with that the same time frame would be in place there. So if we get the test within 2 days, it may be 2 to 3 days before the individual has the result from the time that they're tested. Obviously, there's going to be some variability based upon the number of tests we submit, as well as the number of tests other people submit. So, our hope is that, within 4 days or so, we'll be able to provide results for the vast majority of folks. Again, as the technology improves, as we get more access to the rapid testing, that will continue to get better. Our ideal situation is to be able to tell people their test results within about an hour of when they get tested.
And to add something to that, Dr. Escott, the new program that we're developing actually gives you the opportunity to create a user portal with Austin Public Health. Through that portal, you can get all types of information, but the most important thing is that you can get your result. And we're working with our lab partners to actually have them real-time upload your result as soon as they finish running your test. And so the goal is that with this new program and with our new labs, that we're going to have the opportunity to get you your results as quickly as they're run, which will be much faster than we're currently dealing with, having to sort through the numbers. So our hopes are that we're going to meet that 2 to 3 day time frame, if not faster. We've worked really hard to make sure that we develop a process to do that.
This is a question from the Austin Chronicle. Obviously, not everyone who uses the portal will end up being tested. Will we have data about the people who use the portal and don't end up being tested? And will that help us understand the unmet need in the community?
I'll have Dr. Hewitt answer that question. We are going to have some results and some data, and I'm sure he's going to be more able to talk about that than I.
Yeah, so this user portal, it creates a great surveillance tool or a registry of everybody who's being affected by this throughout the city, throughout the county, throughout the region, as far out as this spreads. So we'll be able to capture not only the people that we test, but the people that we don't test. And we'll see where the people are signing up. We'll see where the asymptomatic exposures are. And we can use that information to target those areas and pull people out of that group that are asymptomatic and test them to see what our asymptomatic carrier rate is. The other information that we'll be able to grab from this tool are all the communities that we're serving throughout the city. And so we are looking for some demographic information that will help to continue to improve how we perform our testing and how we serve the city of Austin and the surrounding areas.
A bit of a follow-up question to that from CBS Austin. Will there be a way to verify that someone who tests positive using this system follows up with APH and takes steps to isolate?
So that's a big piece that we're going to work on with this new enrollment and this new portal. After someone tests positive, it's really important to perform that contact tracing piece. And that's really what we're going to focus on by creating a digital way, an automated way for them to notify, without having to identify themselves necessarily, but for them to notify people that they've come in contact with, or businesses and other areas, to give them a notification that someone has tested positive. And so that contact tracing piece has become a huge part of the reopening plan. And that's something that we're going to work really hard to make work for the community here through this new process.
A question from Estonia. If physicians can still refer patients to testing sites outside of this enrollment form, how will equitable access to tests improve?
So I can take that one. So again, physicians can still order tests as they normally do for other tests. What this allows us to do is to take away the direct physician interface requirement to ensure that individuals who may not be insured, who may have trouble accessing care because they're shift workers and they're only available in the evening, have direct access to sign up for testing. We are working with our partners at Community Care to ensure that we are targeting particular parts of town that may be more challenged in getting that access. And we will continue to identify, as Dr. Hewitt said, the areas that we're testing, the areas that are being signed up for testing, as well as those areas that are not signing up for testing, so that we can do direct outreach to those areas and ensure that folks are aware that they know how to access it, and also that they're not afraid to access it. It's important for people to understand that the information collected here is health information. It's coming to a doctor and it is protected. It's not shared with law enforcement. It's not shared outside of Austin Public Health. and that information is very safe. So we want people to be comfortable in sharing that information and signing up for testing so that we can ensure that there is more equitable access to testing.
I believe that that's all the questions I've got from media. Thank you so much to both of you for taking the time.
You bet. Thank you so much.
Thank you.
And that wraps up this morning's news conference. We have a Spanish-speaking news conference later